Thyroid cancer is a type of malignancy that develops in the thyroid gland, which is a small butterfly shaped gland located at the base of your neck, crucial for regulating metabolism. Patients may initially notice a lump or swelling in the neck, and as the disease progresses, symptoms can include difficulty swallowing, hoarseness, and persistent cough not related to a cold. Other possible signs are neck and throat pain and enlarged lymph nodes in the neck. The treatment typically involves surgery to remove the thyroid gland, and it may be complemented by radioactive iodine therapy, hormone therapy, radiation, or chemotherapy, depending on the cancer's type and stage. Risk factors for thyroid cancer include a family history of the disease, exposure to high levels of radiation, and certain chronic goiters or thyroid conditions. For those intrigued by the intricacies of this glandular ailment, here are detailed aspects of thyroid cancer. Symptoms and progression of thyroid cancer. Thyroid cancer typically begins as a small asymptomatic nodule within the thyroid gland. As the disease progresses, symptoms may emerge, which can include a lump or swelling in the neck, pain in the neck and sometimes up to the ears, hoarseness or other voice changes that do not go away, trouble swallowing, and difficulty breathing. Some patients may experience a persistent cough not associated with a cold. While these symptoms can be associated with benign thyroid conditions, persistent or worsening symptoms warrant medical evaluation. The progression of the disease varies by type of thyroid cancer, with some forms growing very slowly and others being more aggressive. Early detection and treatment are critical for a favorable prognosis. Diagnosis of thyroid cancer. Thyroid cancer is often diagnosed through a combination of physical exams, blood tests, and imaging techniques. A key indicator is a nodule on the thyroid gland, which can be palpated during an examination or detected via ultrasound. To confirm malignancy, a fine needle aspiration biopsy is performed, extracting cells from the nodule for cytological examination under a microscope. The presence of thyroid cancer cells confirms the diagnosis. Blood tests that measure thyroid-stimulating hormone, TSH, levels help gauge thyroid function, but are not diagnostic of cancer by themselves. Advances in genetic testing can also identify mutations linked to different types of thyroid cancers, aiding in more personalized treatment strategies. Early detection is critical, as the prognosis for thyroid cancer is typically excellent with timely and appropriate treatment. Cause and risk factor of thyroid cancer. Thyroid cancer arises when thyroid cells mutate and grow uncontrollably. Numerous risk factors can elevate the likelihood of these mutations, including exposure to high levels of ionizing radiation, particularly during childhood, and a family history of thyroid cancer, pointing towards a genetic predisposition. Additionally, certain genetic conditions such as familial medullary thyroid cancer or multiple endocrine neoplasia type 2 can significantly increase one's risk. Other factors include being female, as women are more frequently affected than men, and a diet low in iodine, although this is a less common cause in iodine-sufficient regions. Greater understanding of these risk factors can aid in early detection and prevention efforts, contributing to more favorable patient outcomes. Treatment and management of thyroid cancer. Thyroid cancer treatment often necessitates a tailored approach, integrating surgery, radioactive iodine therapy, thyroid hormone replacement, and sometimes chemotherapy or targeted therapy, based on the cancer subtype and stage. The most common initial treatment, a thyroidectomy, can be total or partial, aiming to remove cancerous tissue and minimize the risk of recurrence. Post-surgery, radioactive iodine ablation is frequently employed to eradicate residual thyroid cells and potential micrometastases, capitalizing on these cells' unique ability to absorb iodine. Lifelong thyroid hormone therapy typically follows to suppress TSH, a growth factor for thyroid cells, thereby reducing recurrence risks and also compensating for the loss of the thyroid gland's function. Advanced cases may benefit from new targeted therapies that inhibit specific molecules involved in thyroid cancer growth, offering hope for more effective management with potentially fewer side effects than traditional chemotherapy. This multidisciplinary care always emphasizes rigorous monitoring for disease status and treatment response, ensuring the best possible outcomes for patients.